Hello and welcome to Healthy Backs and Bumps class. This is presented to you by the Women's Health Physiotherapy Department at Barts Health NHS Trust. We are based at Whipps Cross and Newham Hospitals. So welcome from me, Gemma, Diane and Suja. We are all specialist women's health physiotherapists, and hopefully during this class we provide lots of relevant information to help you manage your condition and pain and improve your symptoms. So why are you here? So you've been referred to us because you're experiencing pain or discomfort during your pregnancy. Why are you attending this group presentation online? The purpose of this group is to inform and educate you on the physiological and biomechanical changes to your body during the antenatal period, pregnancy, to help you manage and resolve your symptoms as a result. What happens after this? You'll be well informed with regards to the demands on the body in the antenatal period, and will have a lot of practical advice to take away and implement into your activities of daily living. Making small changes on a day-to-day basis is what makes the big difference. We as a team will follow you all up with a telephone consultation to answer any questions you still have from this presentation today. And at that point, we may decide that we need more sessions to discuss with you further information and support you. It may be that further physiotherapy and assessment and treatment will be required, whether that be on the telephone or in the future face-to-face. We will discuss this with you then and ensure a bespoke assessment and treatment is discussed with you and formulated. Aims of the class: to inform and educate you of the changes to the body during the pregnancy, give you lots of practical advice on how to manage these changes to help improve and resolve your symptoms, to give you knowledge so that you know what is okay to do during the pregnancy and that you feel safe. Exercise in pregnancy is really important, and we will cover this more later in the presentation. We will also discuss things like twin pregnancies, where our advice and precautions are slightly different to that of a normal singleton pregnancy. But again, we'll discuss this more later. So pregnancy, I'm sure you're all aware of this, but just to recap, pregnancy is split into 3 trimesters. So our first trimester is from weeks 0 to 12. Second takes us from weeks 13 to 28. And your third trimester are weeks 29 to 40. We also actually have a 4th trimester, which is currently classified as the first 12 weeks postnatal. So what are the changes that happen to our body during pregnancy? This slide here gives you some nice further information on some of the common symptoms and changes during pregnancy. The reason for these changes, a big part, is due to changing hormones. We have a change in progesterone, estrogen and relaxin. Progesterone helps to relax smooth muscle, helps the breast to develop and increases our body temperature. Estrogen helps to develop the fetus and the milk ducts. It increases the blood flow to the placenta. And relaxin modifies your collagen, so it makes your body more mobile, ready to deliver, making the soft tissues more mobile, even making some of the joints in the body a little bit more mobile, which is sometimes why a combination of these 3 hormones can be why we start to present with some of the things that we do later on. We also have an increase in fluid volumes, which can lead to changes in posture. And from above, you can see there's many things covered like indigestion, constipation, increased likelihood of urine infections, increased leakage of urine during coughing or sneezing. Very common but not normal, and we'll come on to that further later, but this is something that we should seek treatment and help with. We can have changes in blood pressure, body temperature. When that increases, that can affect our sleep and just how we're feeling generally. We have an increased risk of infections like bacterial vaginosis or thrush. With regards to the relaxin hormone mentioned earlier, this peaks at about 16 weeks, so the joints and everything feel a little bit more lax and mobile. With regards to all of these changes and the relaxing, it leads to a not as good balance later on and can predispose us with a change in posture and a change of centre of gravity to injuries such as falling over and spraining our ankle. So we need to be aware of what activity is safe, which we'll discuss later. We also have an increased risk of low iron due to physiological anemia. This is to do with the fluid volumes increasing. So throughout, you will have your regular antenatal clinic appointments, midwife checkups, and they will do blood tests to make sure that we are not anemic, and if we are, they will put on the appropriate supplements. Very common to feel quite tired and unwell, increasing heart rate, so we need to be aware of how hard can we exercise. We have an increased risk of varicose veins due to the fluid congestion in the body and due to the growing fetus and how it presses on some of those veins and arteries in our body. And with this, we have an increased risk of hemorrhoids and piles. Sometimes you can prevent with a stuffy nose, you can get nosebleeds, prolonged coughs and colds, shortness of breath on activity. Ribs change position because of the growing fetus, which means the diaphragm has less room for movement, which means we can get short of breath, but also means the ribs flare. And we get changes in our body, including an increase in breast size, which can happen quite early on for some, or maybe for others much later. There are many other things that can happen too, and we will hopefully discuss them further later on if you're thinking something else is presenting with your body. So common symptoms in pregnancy related to many of those other things on that last page. We can get pregnancy-related low back pain, upper back pain, pelvic girdle pain, carpal tunnel syndrome tends to happen later on, and pregnancy-related sciatica, cramps, and more. From the pelvic and obstetrics gynae physio specialist group, they have developed a lovely information leaflet that if you go on www.pogp, I think it's .org.uk, but the full reference is at the end of this presentation. They have a lovely leaflet on some of these things, particularly pelvic girdle pain in pregnancy. From the statistics in their resources, 50 to 70% of women will get pregnancy-related low back pain. 20% of women will get pregnancy-related pelvic girdle pain. These are due to hormonal changes as mentioned on the previous slide, but they're also due to biomechanical changes, changes in posture, changes in joint mobility, changes in fluid volumes, weight, and many others. Carpal tunnel syndrome, like I mentioned, tends to happen later on in pregnancy when the fluid volumes have increased significantly. This causes compression of the median nerve in the carpal tunnel at the wrist, and the symptoms are weakness, pins and needles, and numbness in the hands and the fingers. Other symptoms that can present with during pregnancy, as already mentioned, increased likelihood of spraining your ankle, multiple muscle and joint aches, round ligament pain in the lower abdomen area as everything is developing and growing, hip pain, tendinopathy, so particularly at the hip or the pelvis, pain around the hips, kind of where the bottom muscles, the gluteal muscles insert into the bone. Also issues related to swelling, particularly in the legs and the feet. And your feet often increase in size during pregnancy and don't always go back to what they were before. Everybody's body is different during pregnancy. Please try not to compare to others and listen to your own body as you go on. So what causes these symptoms? As we've already mentioned, hormones, weight gain. So you can see from these lovely diagrams here how this lady's progressing through her pregnancy and how that's changing the curvature in the spine and that posture. Postural changes, which we've already just said, and how we're feeling. So the fetus grows in front, which moves the centre of gravity for our bodies forwards. We get overstretched and weakened abdominals. This then leads to a forward head posture often, and tightness in the chest, neck, and kind of shoulder muscles at the front. This can lead to weakness in the postural muscles of the neck, and can lead to a lot of upper shoulder, upper back tension and soreness. We end up often with an increased rounding in the upper back, but not always. And often the ribs flare forwards to accommodate the diaphragm as the baby grows. The lower back can become more arched, as in this picture, but actually a really common presentation is a tail tucked posture, where the bottom stays tucked underneath and the lower back actually becomes a little bit flatter. The pelvis can sometimes tip forwards, as in the pictures above, or as I just mentioned, can sometimes become tucked underneath, and we become a bit of what we call a buttock gripper or a bottom gripper, and we're gripping those bottom muscles to hold that pelvis and offload the back. So we're all slightly different. Sometimes we have an increased curve in the back of the picture, sometimes we're a bit more flat backed. Knees are often locked or hyperextended rather than kind of standing softly straight, and that's the body's way of trying to find some stability as we're changing in our posture and our body's requirements. The ankles can feel more mobile, as well as the feet, and often the arches in the foot drop and flatten. I'd like you just to pause this presentation now. Have a stand up and look in the mirror if you can. With the presentation paused then, I'd like you to take a photo on your phone, or maybe if you weren't happy to do that, to take some notes and just analyse your posture. Have a look at how you are standing. Really helpful to have a record throughout the pregnancy of how your posture is, and then we can see and address this posture later on in the slides. Also really nice just to see how your body is changing, to maybe think about and link in how all of these changes in your body are affecting how you're feeling too. Posture. So now that we've analysed our own posture, we can have a look at what is good posture. Well, posture is different for all of us. When correcting your posture, you should always do it gently. Nothing ever should be gripped or braced. It should feel relaxed and comfortable. So we're going to go through a few points now. And again, if we go through them, if you want to pause throughout or pause at the end and have a little look and practice, then please do. So as we're looking at the picture on the right, this lady here has got fairly good posture, but we are all different. So just before we give you any cues of your posture, we're just thinking about the spine and actually how we naturally have three curves in the spine. A slight curve in the neck, a slight curve out in the upper back, and a slight curve in the lower back. Now everybody's curves here are different. Some of us will have bigger curves, some of us will have less curves. The lady in this picture has a very flat back, so please don't worry if your back's not quite so. We also then scan down the body and think about the knees and the feet. Some people's feet are comfortable and their hips are happy to face forwards at 12 o'clock. Other people's feet are much more comfortable with the hip anatomy to be slightly turned out to say 1 or 2 o'clock. And some people will even have hips that mean that their toes are actually slightly pointed in. Just be aware that we are all different and just find that comfortable position for you. So, when we're thinking about posture, I want you first of all to stand with your feet hip width apart. So we take the feet together, we turn the toes out and then the heels out. So they're approximately 2 fist differences apart. So if you put 2 fists on the floor, that's how wide your feet should be. Standing here now, we maybe want to take a moment to close our eyes. We're going to think about standing tall. Think about a piece of string attached to the crown of the head with a helium balloon attached to it. Elongate through the back of the neck. The earlobe should sit, if you drop the pencil from it, so that the pencil sits just behind the collarbone. And feel this lightness in the neck, the upper back and the torso. Shoulders are relaxed and back. Think about drawing a smile with your collarbones, or imagine you have a beautiful diamond necklace on and you're trying to make those shoulders and collarbones wider and stand proud. You can also think of a piece of string gently drawing your shoulder blades down the back, imagining drawing your shoulder blades to the opposite back pocket. Scanning down now to the ribs, thinking about gently tucking the ribs in, almost like they're a drawer and you're just gently sliding them back to the wall behind you. Moving down to the pelvis. We can place our hands on our hips here if that helps you, so the hands are on top of the pelvis. What I want you to think about here is just gently moving that pelvis forwards and gently moving that pelvis backwards. Trying to keep everything else above lovely and long and soft. And then find the midpoint, where the pelvis feels like it's sitting in the middle of those two extremes of motion when you tip the pelvis forwards and backwards. Should have a small awareness in the back of your mind that there's a paperweight attached to a piece of string on the tailbone, gently weighing that tailbone down towards the floor, providing a little bit of heaviness through the back of the body. Moving round to the front, to the lower tummy, I want you to think about those abdominals smiling. So from hip bone to hip bone, you should feel this smile or hug of support as you stand in this new posture. That already as you've corrected your posture as we've scanned down the body, you can feel those deep abdominals hugging up and in, supporting the growing baby and your pelvis and spine. Knees should be soft, not locked, and headlights on the kneecaps, generally facing forwards, or anywhere between that kind of 12 to 2 o'clock. Feet, as we already set up, 2 fists apart, no wider. And the toes are spread into the floor like we're standing on a sandy beach, with the big toe gently pressing down, and imagining a small space underneath the arch of the foot for a blueberry. Just take a moment to pause. Close your eyes. Think about how this posture feels. It should feel soft and effortless, maybe a little bit strange, but it should feel easy. I want you to try and remember this posture and how it feels, and try and pull yourself up at points through the day and see if you can think about these areas of alignment or areas of the body, and see if we can work on improving that posture to help offload common areas of pain, such as the upper back and shoulders or lower back, from maybe just how we are standing and carrying ourselves. So, pregnancy-related pelvic girdle pain. What is it? So, according to the European Union guidelines, it's pain experienced between the posterior iliac crest, which if you have a look at the back of your pelvis, you'll see 2 dimples. So just at the bottom of your lower back, above your bottom. And the gluteal fold, which are those creases of your buttocks. Particularly in the vicinity of the Sacroiliac Joint, the SIJ, which is, if you feel those 2 dimples, just below and to the outside of those 2 dimples in the lower back. This pain can often move around, so you can see in the picture here, so just if you were looking from the back here, this is the sacroiliac joint here on both sides that are highlighted red. You've got the pelvis, and then you've got the base of the spine that comes into the sacrum. So the sacrum kind of forms the joint here with the ilium, which is the joint in the pelvis. But you can see this lady is getting pain in her lower back, also pain around the pubic symphysis at the front, pain on the sides of the hips on both sides, and also pain down into the groin. It is caused due to hormonal, physiological and biomechanical changes during pregnancy. It's often related to an imbalance or an asymmetry in the pelvis due to these changes. It can cause pain in any of the 3 pelvic joints, and it can move around. Often we say it is caused by an asymmetry, where the joints around the pelvis may feel like they are under strain and not coping. When this asymmetry occurs, i.e. one side is maybe stiffer than another or more mobile than another, we often present with this pain or discomfort. As a result, the muscles around the pelvis may be tight or go into protective muscle spasm as a clever strategy for the body to protect itself. However, often these muscles then forget how to let go and calm down. This normally responds successfully to treatment from an experienced manual therapist. However, there is much you can do at home to find these problem areas and gently release them yourself, alongside specific stability exercises to ensure we are giving the pelvis some support back and that we're not taking all of this tightness away that it's using for a support system, to ensure the pelvis feels safe and supported and happy to let go. This will help to manage and resolve the pain or discomfort. Why do I get it? Is unknown. But some risk factors for why you may get it is because you've had it in a previous pregnancy. Maybe that you've had history of trauma to the pelvic area. Sometimes we can get it later on with second, third and later pregnancies. If we are overweight or have a raised BMI, we have a heavy workload and maybe our body is not conditioned or coping with that workload. Poor workplace ergonomics, so not sitting or standing in the best postures or positions through the day. Hypermobility sometimes as well, so people with EDS and different conditions may be slightly predisposed to it. And sometimes it can be from a previous birth where maybe we've had a excessive abduction in labour. So pregnancy-related pelvic girdle pain, I'm going to give you some lovely resources at the end to go and have a little read through more. But common aggravating activities for this pain are turning or rolling in bed, walking, getting out of the bed, the car, the bath, the chair, standing on one leg, going up and down the stairs, opening your legs wide apart, which we call hip abduction, which is about abducting the leg away from the body, crossing your legs over past the midline, so sitting with the legs crossed or lying in bed with one leg over the other when you're lying on your side. And pain may be exacerbated with sexual intercourse. If any of these activities are aggravating your symptoms, please either firstly modify them, reduce them, and then stop them. This will help calm down the pain and settle the symptoms. You will then work with us after this session at identifying and resolving the cause of these issues, and we will give you graded exercise to return to these activities to help you get back to pain-free function, or maybe just reducing the pain but significantly reducing it. Physiotherapy is very effective here. We use many adjuncts as well as exercise, which we will discuss further with you in your one-to-one sessions. So, management. You'll be assessed by us and you'll have a bespoke treatment plan. PGP is very different for every woman. You may have an onward referral to other professionals such as occupational therapy to look at your desk space or work environment. It may be that you need referring to social services for advice on benefits or care package for help at home. You might be provided with walking aids, adjuncts such as a pelvic girdle belt, and you may be referred back to the GP for pain management. You need to manage and plan your diary so that you pace yourself and try to coordinate hospital appointments so that they're on the same day to minimise trips out and about. So some do's and don'ts for pelvic girdle pain. And again, these are summarised in some of the resources later on. Try and sit or stand symmetrically. Keep as active as you can in pain-free limits. Keep legs together when getting in and out of the car or rolling in bed. So a really nice one is to sleep with a pillow between the knees, ideally on your side, with a towel under your waist and your bump. When you roll in bed, think about gently squeezing the pillow between the knees with the legs, and then try and squeeze your bottom and lift your bottom up as you roll. Pace yourself, rest when needed. Ask or accept help when needed. Sit when dressing to reduce the time spent standing on one leg and twisting, because that's some of the worst things you can do if you've got raging pelvic girdle pain. Take stairs one at a time. Good supportive shoes can really help. Think about how you're carrying loads, so backpack rather than a handbag, but try and keep it light. And then we'll go through some pelvic floor techniques later on, but for nag, exhale and lift the pelvic floor muscles prior to lifting load. Gives the pelvis and the lower back a hug of support, and we'll go on to this in more detail later. Don'ts. So these are only don'ts if they're causing aggravation of your symptoms. If they are not, you're fine to carry on with them. So if this is causing aggravation, don't take the legs wide apart. Same with standing on one leg. Twisting or bending or carrying on one hip if aggravating your symptoms. Avoid aggravating movements. Don't lift heavy loads if causing discomfort. And activities such as vacuuming and activities at home like gardening, just be aware and monitor and make a diary of what is making you worse or not worse, so that we can see what are the drivers here and what we actually need to step back away from to calm down the pain, and then work on conditioning the body towards being able to do in the future. For all of us, even if not painful, we want to think about not sitting with our legs crossed, particularly in pregnancy. This can cause long-term tissue stretch in the tissues at the back of the pelvis that help to support and stabilise the back of the pelvis and lower back. So a really good habit is to not sit with those legs crossed, because we want nice support from those structures and tissues at the back of the pelvis so that we hopefully don't present with things like pelvic girdle pain. Try and sit nice and symmetrically. And it's the same with standing if you're at work. Try and think about being nice and even and symmetrical and regular movement. So try not to sit twisted or sit on one bottom cheek or stand on one leg. Think about kind of being a little bit more active and using those muscles and working on your posture. So moving on to pacing. So plan your day and take breaks. Avoid painful and stressful triggers. Change position regularly and exchange heavy bags for light, which we covered all on the last slide. So moving away from pelvic girdle pain, moving on to pregnancy-related low back pain. The EU guidelines define low back pain as pain between the 12th rib, so kind of just below where the back of your bra is. If you follow the back of your bra down, you'll feel kind of the ribs come to the end, just below that, maybe a few fingers below. And then radiating all the way down to the gluteal fold. So going right down to that bottom crease underneath your bottom. This can be with or without leg pain. Generally tends to be worse towards the end of the day, but not always. And as we said here, it can refer into the legs. So a common symptom can be things like sciatica, but not always. So what is really important to be aware of in pregnancy-related low back pain is that we are changing with our hormones and our biomechanics and posture and weight, which basically mean the body is having to carry a lot more load in an altered posture and maybe a less supportive environment than it's used to. So we just need to ensure that we screen for anything more serious and make sure that we seek treatment if there is anything more serious going on. This slide and the next slide just give you those screening tools just to be aware of that if we are thinking that this is us, we do need to go and seek further advice. So this is a little card that you can actually download and you can print off yourself. So thank you for the Manual Association of Chartered Physios for this. But common back pain, what they say is many patients have a combination of back pain, leg numbness and weakness. These symptoms can be distressing for you but don't necessarily require emergency medical attention. So this is where physiotherapy can help. However, a rare but serious back condition called cauda equina syndrome can lead to permanent damage or disability and will need to be seen by an emergency specialist spinal team. And we're going to go over these signs and symptoms now of this cauda equina. So if you feel like you do present with any of these cauda equina symptoms, we do need to seek further help. So cauda equina would present with loss of feeling, pins and needles between your inner thigh or genitals. So this is what we call the saddle area. So if you were sitting and on the toilet and about to wipe after finishing, you should be able to feel yourself wiping. If we have any altered sensation there, that could just be a warning sign. Numbness in or around the back passage and the bottom, so the buttock cheeks. Altered feeling when using the toilet paper, which I just covered. Increasing difficulty when you're trying to go for a wee. Increasing difficulty when you try to stop or control your flow of wee. Loss of sensation when you pass the wee. Leaking. So if you're leaking urine or you recently need to use pads more. Not knowing when the bladder is either full or empty. You have an inability to stop bowel movements or leaking. You have a loss of sensation when you pass the bowel motion. Change in ability to achieve an erection or ejaculate. And loss of sensation in genitals during sexual intercourse. Now, obviously, this applies to men and women. And I would say that sometimes we can have a couple of these symptoms and it isn't anything serious. But if we are noticing that both of our legs are becoming weak, giving way, and we are getting maybe a cluster of these symptoms, or we're just not sure, speaking to your GP, if you have a soon appointment with us, great, and we'll discuss it further. Or if ever worried, please ensure that you refer yourself to the emergency department to screen you further. This is a very small percentage of cases, but it's just to make you aware. So, most of us will present with common back pain. So how do we manage these symptoms? Well, there are lots of things that we can do. We can use ice and heat, TENS, so electrical stimulation, acupuncture, pain medication, adjuncts such as a pelvic girdle belt. So these apply to low back pain and pelvic girdle pain. Massage and self-release techniques. Avoid the aggravating activities. Follows the do's and the don'ts for pelvic girdle pain. Movement education or modification. Specific exercises to release, balance, stabilize and strengthen. And that's what we are here for, to help you with all of this and guide you. So the 5 handy P's in pregnancy. We've got pacing, we've gone over a little bit already. Posture, which we've already gone over a little bit too. Pelvic symmetry, which we've mentioned in the pelvic girdle pain kind of information slides. But basically, the research kind of supports that if we're getting pelvic girdle pain, it's normally to do with an asymmetry. So if we can get things a little bit more symmetrical through that pelvis, generally that helps to manage our pain and symptoms. Pelvic floor muscles, which we're going to come on to more, and physical exercise, which we've just started touching into slightly, and we're going to discuss further as we go on. These 5 handy P's are just really good to be aware of, because if we can manage all of these things and be proactive with all of these things, our pain and symptoms generally tend to be a lot better. So the pelvic floor muscles, what are they? They're a group of muscles that attach from the tailbone, and then they go up and forwards to the pubic bone at the front. They fan out each side to reach to each sit bone, and they are a diamond in shape, from tailbone to sit bones to pubic bone. If you pinch your cheek, this is roughly how thick they are. What do? They help you to control your bladder and bowel, keeping you continent. They support and stabilize the trunk, which is the back, the tummy and the pelvis, and your growing baby. They lengthen to accommodate giving birth. So having muscles that are strong through full range, able to fully contract and release is super important. As when we give birth, research suggests that they can stretch anywhere from 200 to at least 400% of their resting state, which in a normal human wouldn't be possible, but is an incredible thing that happens in pregnancy related to the hormones that allow the body to stretch that much further. But this does mean that we need to get those muscles super strong pre-giving birth, and that we do lots of rehab on these muscles after delivery. Now we will discuss this more, but even if you have a C-section, you still need to do the recovery and the work on the pelvic floor after, because those muscles have been under load for 9 months and will still be stretched to an extent. So, they also contribute to sexual sensation or orgasm. So if ever there is any incentive to do your pelvic floor exercises, if you do your pelvic floor exercises and get nice, strong, healthy muscle down below, you actually improve your orgasms. So you have a better sex life, which I think is always a good driver to do those pelvic floor exercises. So why do I need to do this? Why do I have to make them strong? There's an increased load of the baby during your pregnancy, so the baby gets bigger and bigger and bigger. There is research to support that the pelvic floor muscles aren't able to contract as well. So we need to work on strengthening them throughout that pregnancy. They get lengthened significantly during birth, which I mentioned. They need to be able to be strong through range, and hopefully that will link to reducing the likelihood of any perineal trauma or perineal tears, as the muscles are able to relax and let go to help the baby be delivered. They are also, as we mentioned above, really important in keeping us continent. Later in pregnancy, we start to get issues with urinary and sometimes fecal incontinence. So to ensure that we stay continent throughout the pregnancy and regain full continence after the pregnancy, it's really important that we fully rehab these muscles and get them strong so they're able to withstand pressure, and also strong with good endurance, so they're able to provide us that structural and postural support. If you look at the picture here, you can see a lovely picture of the pelvic floor muscles here, from the coccyx, like a hammock, through to the pubic bone. And you can see them supporting the bladder, the uterus, and the bowel, wrapping around the end of each entrance, providing closure when we need closure, but also allowing us to empty when they relax, or deliver the baby through here when we relax as well. So what is pelvic floor muscle training? How do we do it? So we'll go on to later on, but there's a brilliant app that you can download called NHS Squeezy that will guide you through and help you keep a record. You can use this with us as well, and we can log in and create a program with you that will help us to see how much you're doing and to tailor the program and make it more bespoke to you. So when we do pelvic floor muscle training, we always start in the easiest position to do them, and then we progress it to more difficult later on. So the easiest position to do them to begin with would be in side lying. You then progress onto crook lying, which is lying on your back, slightly propped up with knees bent. Sitting in a chair would be your next kind of level, into standing, and then into more functional symptomatic postures where you're getting issues with maybe incontinence or issues and signs and symptoms of other pelvic kind of dysfunction or complaints. So how we do it? Let's have a look at the jellyfish. So if you look at the jellyfish here, you can see I've put the words inhale and exhale next to them, okay? But you can see the jellyfish on the right is this lovely wide expansive jellyfish, and then on the left it's kind of narrowed in, drawn up and in, and that's how it propulses forwards. So when we breathe, our diaphragm co-contracts or works with our pelvic floor. So if you all sit and take a lovely deep big breath in now, this is what's happening to our diaphragm and our pelvic floor. Just take a few breaths for me and feel if you can feel that. Think about sending the air into the base of each lung. It's almost like when you breathe in, you feel the air enter all the way into the top of the lower back. And you feel this lovely expansion of the rib cage out to the side. That's that widening of the diaphragm. Hopefully you all felt that. Now, if I all get you to imagine you have a straw in your mouth and you're going to imagine blowing up a balloon through the straw, I want you all now to think about the diaphragm and the pelvic floor. Don't do anything, but just blow through the straw and feel what happens. So I want you to blow as far as you can blow through that straw all the way out. Then obviously have a rest, inhale, and then just do that a few times. And what you should be feeling is at the end of that exhale, you should be feeling some narrowing of the rib cage, some drawing up and in of the pelvic floor, and maybe even some drawing in of that lower tummy away from your underwear line, so you feel like your underwear actually feels a bit loose. And that's great. So we know if you breathe well, we know that your pelvic floor actually naturally works functionally. So when we contract the pelvic floor, we are going to work on this sensation of stopping wind or bowel movement. You're doing a lift to stop up and hold away. You are thinking about maybe even pieces of spaghetti, and this is just imagery, please don't ever do this. But if you thought of a piece of spaghetti in each passage, back, middle and front, and imagine that drawing up and in, okay? We want to be like the exhale, the diaphragm and the pelvic floor will, on the exhale, draw up and in and lift. And you can see that on the exhale picture of the jellyfish here. That's what we want our pelvic floor to do. We want this back to front contraction of back passage, middle passage, front passage, everything lifting up and in. Feeling the lower belly hugging in, exactly as we did on the exhale. And that's why we cue you to do it on an exhale to begin with. We then need to focus on the inhale jellyfish, which is just fully relaxing and resetting. So we need to make sure we have a good in-breath. And again, when we're learning this, we always do the inhale as we relax, because we know we're already getting this much relaxation of the diaphragm and the pelvic floor. So we're going to think about fully relaxing, resetting, widening the seat bones, letting the perineum descend down into your underwear. And that's really important. 1 or 2 or maybe even 3 things to think about here when we do pelvic floor muscle exercises is never to hold your breath. If the breathing and coordination of everything is too much, don't worry, but don't hold your breath. Just make sure you are breathing. You should never feel any pushing or bearing down. And if you do, please stop. Pushing or bearing down strains the connective tissue underneath through that pelvic floor area, and over time can lead to laxity in the tissues down below, not providing as much support for the pelvic organs, and can lead to complications or complaints such as prolapse in the future. So really important we don't push or bear down unless instructed by a medical professional to do so, but just think about that. Do not tighten your tummy, bottom or thighs. So we are working only that pelvic floor hammock, that diamond underneath us. So if you're feeling anything else in your body tensing, just stop, reset, try a little less, do it more gently. And as you get better at getting it in isolation, that's then later on where we can increase the power of that contraction. So what we're looking for are strength and endurance exercises. We're aiming for 10 of each. So the strength would look like inhale, prepare, exhale, let's tighten and lift up that back, middle and front passage. So the lower tummy hug in, and then relax, let it go. Have a breath, and then off you go again. Exhale, back passage, middle passage, front passage, lift, think of that jellyfish, hug the baby, and then let it go. And make sure you fully let go. Take some time here to fully relax. Feel that diamond widen and open. Think of that inhale jellyfish on the right. We'd go through that 10 times. And 10 may be too much, okay? We might start on 3. It's better to do them well. Endurance, we then aim for 10 10-second holds. And generally to start with, maybe have about 4 seconds rest in between each, but you might need longer. If this is ambitious to start with, just start on a few and build your way up. It's quality over quantity. Again, inhale, prepare. Exhale, think of that jellyfish lifting up and in. Feel all 3 passages draw up and in for the lower belly hug in. Seat bones are drawn together. Now we're going to keep breathing and hold that pelvic floor up. Keep breathing and keep the pelvic floor up. And you keep breathing and you keep the pelvic floor up. Then when you reach your 10 or maybe it's 5 to start with, make a record on a piece of paper. Fully let go. Have a big deep breath in. Think about widening and opening the seat bones, letting the perineum descend down towards your underwear, and chill. Have a rest and repeat. So, in the ideal world, at least 3 times a day, strength and endurance, and really just working on that isolation of contraction. If you want to have a bit more of a go now, pause the video and have a go without me. Think about those cues that I used, the seat bones drawing together, the jellyfish swimming, the spaghetti drawing up inside. A couple of extra cues, if you're finding those ones hard, are thinking of an escalator lifting up and forwards, or even a zip from the back to the front. And then if you're finding the relaxation hard, which can be a really nice top tip in the future if you progress into sitting, is getting a rolled towel and placing it in between your bottom bones and sitting on that. And then you can really feel for that perineum area, the area in your underwear, lifting up away from the towel and then sinking and relaxing back into the towel. There are many other techniques we can go through, and we will go through when we see you one-to-one, but just pause and have a little go at this yourself. The pelvic floor muscles and labour. Moving on. As already mentioned, they can stretch from anywhere from 200 to 400% of their normal resting length. Very important to prepare for stage 2 of labour, the pushing stage. we want to basically reduce the likelihood of any birth trauma or perineal tears. So really important things to think about when we've gone over the pelvic floor training also are to carry on with that pelvic floor muscle training, as I've already mentioned, to make sure that you're good at lengthening and letting go, as well as tightening and supporting. So you're managing pain and dysfunction, but you're also able to let go and relax. If you think of lifting a shopping bag from the floor, if with a fresh arm you lift the shopping bag up, it's no problems. However, I left you there for half an hour with a shopping bag lifted halfway up in the air and then came back half an hour later and said, now lift that up onto the table. You might look at me and say, no way, my arm is so tired. The same with the pelvic floor. Super important to make sure you let them go and let them relax when they need to, so that they're able to tighten and support when we need them. What can be very beneficial is to look into further relaxation techniques, labour positions, hypnobirthing and delivery methods. Birth planning and more, really, really, really important parts of your pregnancy so that you're well informed and aware of how you can relax your own body. These should be covered in antenatal classes with the midwives, or there is much further reading and some of the resources will point you in that direction. But when we come to relaxation techniques, if we think about the importance of breathing exercises, and we know that they're really important because actually we know when we breathe well and we release that diaphragm and our back is more mobile, we know the pelvic floor are actually releasing without even thinking about them. Perineal massage, you can start from 35 weeks pregnant. Really important to try and help relax the soft tissue around the entrance of the vagina, helping you to deliver baby. Hopefully reducing the likelihood of a perineal tear or any complications. There are products such as the Epino or Anibal, which you can use from kind of 36 to 37 weeks out of your pregnancy. And again, they're there to try and help you lengthen, let go, relax those muscles, and again, help you to deliver with baby's head coming through and hopefully reducing the likelihood of complications. Only push when needed, and trying to relax and push when needed, and making sure you're well prepared and aware of good positions. Like in this picture here, we can see this lady is in an upright forward leaning position, which is better for the baby to be delivered. It makes the pelvic outlet have more space and again helps to reduce the risk of birth injury. Hopefully then we aim to have a second stage less than 2 hours. At birth, where muscles are better at lengthening, not always, but hopefully does the best that we can to help reduce the likelihood of needing any adjuncts for assisted delivery and reducing the likelihood of any injury. So we can't prevent these things, we can just do our best to try and improve how things go. Everything in labour and birth just have to be kind of ready to go with the flow, but any of this that we can do to help is going to benefit our body. So, moving on to defecation dynamics. So when we're talking about pelvic floor, we've done lots about strengthening it, we've done lots about relaxing it, we've done lots about preparing the soft tissue for labour. We also need to think about something we do every day, which is going to the toilet. Now you can see how the lady in this picture here is sitting on the toilet, relaxed, with her feet up on a stool, knees are higher than her hips, and then she's leaning forward, so she's relaxing on that toilet. Her back passage comes out through here, and in this position, rather than it being more of a U bend and poo having to go around a right angle, it becomes more like a chute, so that when she relaxes her pelvic floor, relaxes her tummy, maybe makes a low hum, or maybe just does a sigh out and lets everything flop and chill, she's much more able to release those stools and empty her bowels in a more effective and efficient way. What we mustn't do when sitting on the toilet is spend hours sitting there and strain or push to empty, because we know that that's going to stretch all of that soft tissue, reducing the support network there, linking into maybe pelvic floor dysfunction such as incontinence or prolapse in the future. I highly recommend one of these stools for everybody. Maybe you have one that your child has at home already, or you can look at Amazon and look at Squatty Potty or Squatty Potty different models, but they're little stools that basically fit around the toilet, and they just transform how you empty your bowels for life. When we're thinking of pregnancy, if we're suffering with hemorrhoids or piles, then this is also going to help to manage and improve them. Now, what we haven't mentioned on the slide here, but there are many techniques that we can also use to help you empty further. So if this still doesn't help, we've kind of mentioned at the bottom here, have plenty of water, eat lots of fibre. What really should be on there as well is exercise, really important to keep those bowels regular. But also we have lots of techniques such as providing some support on the perineum with our fingers to support that kind of connective tissue to allow you to empty, or even using things like irrigation at the back passage or a finger to help you manually evacuate the stool from that back passage. These are things that we can go over more with you in our one-to-one sessions. So physical exercise in pregnancy, we're here. So what we need to just be aware of before exercising is if we have any of these signs or symptoms, we must speak to an allied healthcare professional, be it a midwife, physio, doctor, before you exercise. So if you have any of these things, please speak to us before you do exercise. There is a brilliant tool on the internet called the PARMed X form, which is Canadian, and it covers all of these and gives a little bit more information about exercising. So if you have more questions about this, the PARMed X form, the PARMED X form, and exercise in pregnancy is worth a read. It really informs you of like what the risks are, what you need to be aware of. Vaginal bleeding, quite straightforward. Reduced fetal movements. Serious heart, lung, kidney or thyroid disease. Poorly controlled type 1 diabetes. History of miscarriage, premature labour or small for date babies. High or low blood pressure. Placenta previa, so if the placenta is low or lying around that cervix, that's really important that we're aware of that. Incompetent cervix. So generally you would be aware of this, not always, but if you have a history of miscarriages, that's why we ask that, because that can be related to this. Often you will have had a cervical stitch, but we really do need to be aware of that. Acute infectious disease, preeclampsia, so you will have been diagnosed with this and been told by the midwife, but it's related to an increase in blood pressure, an increase in protein, and twin pregnancies, because everything is under twice the strain in a twin pregnancy. And it's not that you can't do anything, but it's that we need to be aware, and then we will modify what you can do. So, physical exercise in pregnancy, it's safe. Many guidelines out there to support it and lots of evidence to support it too. So what does it do? A big one is it maintains cardiovascular fitness, breath control and muscle strength, which are really important for pregnancy and beyond. We are going to get heavier, and then we're going to have a kettlebell delivered, and we're going to have to start lifting that kettlebell straight after a big maybe operation if we have a C-section or the birth delivery. So we need to get that body as strong as it can be now to manage the pregnancy, but also for after. It helps to manage our weight. So we are expected to gain no more than 2 stone of weight during the pregnancy. If we're overweight to begin with, it's actually less than 2 stones. So we need to bear that in mind, okay? There is a higher prevalence rate these days of gestational diabetes, so pregnancy-related diabetes being diagnosed. So eating healthy and moving more prevents this. Gestational diabetes will mean that you will need extra monitoring during your pregnancy to make sure that the baby and you are well and safe. Mental health and well-being benefits too, really important, particularly postnatally. We need to be aware of and seek support for things like postnatal depression. But during these times at the moment with COVID and a lot more isolation in many ways, we can even present with these things antenatal. So we just need to be aware of this. There are lots of online support groups, online apps like Peanut, and things like NCT and different things for support groups as well. Because I think especially in these times where we're maybe not able to socialise in the same way we used to, we need to seek other methods of socialising and support too. And there's lots of benefits in research for the baby too. So some of the research articles out there even suggest that the baby is ready to be delivered earlier, that they're more athletic and all sorts after. Now, there's many variables in those research, but really positive. So this is a lovely infographic from the government, and it guides you through what the government and the Royal College of Obs and Gynae suggest we should be doing in pregnancy. There are many other guidelines to support this too, from the UK, Canada, Australia and more. So you can see here mentioned at the top, some of the ones I didn't mention are things like improving sleep and managing blood pressure. Not active, there's guidelines on how we start, which I'll cover in a moment. Already active, keep going. Muscle strength, lifting some weights, body weight, small weights, resistance bands twice a week. Every activity counts in bouts of at least 10 minutes. If you're really struggling with nausea and things early on, just do what you can, even a walk. And later on in the pregnancy, that should get better, okay? No evidence of harm, but we must listen to the body and adapt. So if we're running at the beginning of the pregnancy, later on when we get heavier, maybe running's not appropriate. It's up to you how long you run for, but you have to think about the load going through that pelvic floor. And there's lots of other exercise you can do other than running. So we need to listen to that body and just see how we feel with our body during the pregnancy. Don't bump the bump is a little bit cheesy, but it's saying that we shouldn't be doing contact sports. We shouldn't be doing things like horse riding. We shouldn't be doing things like riding a bike after 5 months where we could fall off and hit our abdomen, which obviously the baby is in the tummy by that point and it could cause damage to you and the baby. And things like skiing, anything where there's a risk of a fall or injury to your tummy, we need to think about modifying those activities, particularly after the end of the first trimester when the baby moves from the pelvis into the abdomen. And we're actually aiming for 150 minutes of moderate intensity exercise a week, which is quite a lot. And it should be moderate intensity. You should be able to talk in broken sentences. So you are able to push it to the point that you are getting hot and sweaty, but you can still have a broken conversation. So, if you're completely averse to exercise, you're advised not to start anything new until after the 13th week. The reason for this is that the risk of miscarriage is highest in the first trimester. Once you've gone past this 13th week, the baby starts to move up from the pelvis into the abdomen, and you can start to exercise gently and progressively. So we'd start 10 to 15 minutes 3 times a week and gradually increase this to 30 minutes most days of the week. Muscle strength, again, twice a week, but start with just very small body weight exercises and progress gradually. You should be able to talk in broken sentences when exercising. And some examples of nice exercise to do would be things like Pilates, yoga, it could be walking, swimming, cycling on a static bike, an online exercise class, anything that you enjoy as well. So for the non-regular exerciser, if you were exercising less than 2 to 3 times a week, you're advised not to start anything new until the second trimester, again, because there's a higher chance of miscarriage in that first trimester. From 13 weeks, you can then start 15 minutes times 3 a week and gradually increase to 30 minutes most days. Strength training as before, and again, talking in broken sentences. So you can carry on with what you were doing before through that first trimester, but don't start anything new till later on. And then the regular exerciser, carry on with what you're doing through that first trimester. And then if you want to work on improving your fitness or just holding it where it is, that's fine, you can do that. And after the first trimester, you can start to do a bit more if you want to. And aim for at least 30 minutes most days of the week. Strength work twice a week. Again, talk in broken sentences. Elite athletes are able to push harder because they have extra monitoring available to ensure they are safe. So please just make sure you're not pushing it too hard, okay? Doing some HIIT training on a bike, a static bike inside is fine, as long as you're able to talk in broken sentences and you just reduce your upper threshold, so you're not pushing quite as hard as you normally are. And if you're used to doing super long training sessions, think about maybe shortening down the length of your training session and maybe adding in a bit more yoga and Pilates type exercise. So we've already gone through this already, but here's just some examples of what to do. So outside on your bike to start with, fine, but ideally after 20 weeks, just think about if you did fall, the risk that could happen to abdomen and baby. And not that we can go skiing and things at the moment that easily, but thinking about actually reducing contact sports or sports where we're likely to fall, like horse riding, mountain biking, skiing, and thinking about other things like Pilates, yoga, something that's less likelihood abdominal injury or a fall. So I've already covered a lot of this, but things that aren't safe are listed there. Avoid exercise where your tummy domes and bulges out. So you can see on this picture, this lady's tummy here is like a Toblerone. So I call this a Toblerone tummy. So she's just maybe lifting her head, and you can't see that on the camera, but just lifting your head in a lying position can do it. You might even notice as you start to get out of the bath like you used to, you've noticed your tummy becoming like a Toblerone. So we need to avoid anything that causes this. We are stretching and straining those abdominal muscles not in the best way. So think about modifying your exercise, take it down a notch. If you're getting out of the bath, roll onto your side, leave the water in the bath to get out and then get out, rather than letting all the water getting out and then trying to get out without rolling with no water. It's quite difficult as you get heavier. So think about these small things. Lying flat on your back is not advisable. Now the research out there varies on how many weeks, but on the safe side, I would say after 16 weeks of pregnancy, try not to lie flat on your back. The reason for this is that the growing fetus, growing baby, puts pressure on your major arteries and veins and can cause a massive drop in blood pressure. This can affect you and the baby. On that note, we should avoid any inversions such as shoulder bridge or anything where our pelvis is higher than our trunk or our thorax, because this is going to increase the likelihood of this happening. If you want to exercise on your back, you need to prop yourself up to about 45 degrees. So that you have pillows or something behind you, a wedge, so that you're not lying flat on your back. Once we get into second and third trimester, we should be doing no abdominal exercises such as sit-ups, crunches, etc. because those muscles around the tummy need to be allowed to lengthen to accommodate the growing baby. And if we're working on tightening them, we're kind of not helping that body change. There are lots of ways we can gently work the abdominal muscles, such as 4-point kneeling exercises in Pilates, doing a little bit of side lying work, swimming, walking, cycling, more functional exercises, even weight training. Look at lunges and different overhead presses with the arms. But we don't want to be doing lots of exercise to shorten and tighten that tummy. We want to allow it to open and let go. Having said that, what we touched on briefly earlier was when we did the pelvic floor exercises, is when you do those pelvic floor exercises, you should feel at the end of the pelvic floor exercises that lower belly hugging in, or those deep abdominals smiling in. And that is what I call the baby hug. So as you do the pelvic floor lift, you should feel the lower belly hug and kind of support the baby. That is working your deep abdominals. So when you're doing any of your exercise, be it going for a walk or doing stuff in 4-point, you want to be thinking about that baby hug exercise. Those baby hug muscles should be gently working to support the spine and pelvis and hopefully help you not do this Toblerone tummy so much, because you've got more support from underneath. Those muscles are really important to work throughout the pregnancy because they work as like a hammock for the baby, and as the baby gets bigger, we definitely need good support to support that baby and offload the back. So in summary, we've gone over pacing, posture, pelvic symmetry, pelvic floor muscles and physical exercise. We need to let pain be the guide on our activity. There are not things that we shouldn't do per se to start with. It's guided by if we're getting pain and that's aggravating, we need to stop, modify, reduce and speak to physio. Think about your posture. Think about how you bend and do activities at home. Try and optimize this. Work on that pelvic floor, get it strong, get it good with endurance. Think about the neck. Pre-activate that pelvic floor. So lift that pelvic floor on a breath out with the baby hug. Before you lift your toddler, before you lift the shopping, think about supporting those pelvic organs and back and pelvis. Think about equal weight bearing. So when you're standing and sitting for long periods, try not to sit with a crossed leg or sit on one buttock. Try not to stand with the hip dropped. Sit down to put your clothes on, make it a habit. Using a float between your legs if you swim, if you get pain, or a pillow between your knees in bed to roll. And avoid anything which causes any pain or discomfort, whether that's standing on one leg, legs out wide, or or any position in yoga or in general day-to-day that you're finding are increasing your pain levels. Make a note of this so we can go through it with you on your assessment, and we can really help get to the root cause of what's going on and help improve your problems and pain and symptoms. Some reading. So we have these lovely booklets available on the internet. This is the link I mentioned earlier. So actually it was pogp.csp.org.uk. This is just some of the leaflets. This pelvic floor muscle exercise leaflet is fantastic. There's advice all about being fit for birth and fit for your pregnancy, and also all about pelvic girdle pain. We also have a few resources here listed. So here we have some further reading. All of these websites are brilliant. There's also a brilliant YouTube video to watch down the bottom, just to provide further information on the topics that we've discussed. The Pelvic Partnership has lots on pelvic pain, NCT lots on antenatal period and beyond, gentle birth lots on labour and birthing. NHS has lots of information on pregnancy and postnatal as well. And then also on this second page, we have further information on the Aniball and the Epino, which are mentioned in your pelvic floor preparation for labour. We also have Stress No More website, which is brilliant for pelvic floor exercise products, supports, and lots of support garments that we can wear during the antenatal period, such as support leggings and things. There's also a risk calculator that you can look at on the internet that calculates your risks with different delivery methods for pelvic floor issues as well. Some further information on perineal massage and some evidence to support that too. So that brings me to the end of the presentation. I hope you found that really interesting and informative. And when we go back to the beginning of the presentation, I hope that means the aims that you feel well informed and educated of the changes that happen to your body during pregnancy. You've had lots of practical advice on how to manage these changes to help improve and resolve your symptoms. And you've been given knowledge that you know what is okay during the pregnancy and that you feel safe to exercise. This will now be followed up by a one-to-one telephone call session with one of the Women's Health team, myself, Diane, Suja, or another member of the team. And this will answer any of your questions. So please make sure you have any of your questions noted down so that we can answer them. It will also identify if we need to plan or further assess your signs and symptoms further and plan a bespoke treatment plan for you. And that may or may not include further physiotherapy sessions. So after this presentation, if you haven't received a telephone call one-to-one appointment with one of the Women's Health team physios, please do contact the physiotherapy reception and make sure that you have been booked in. And I hope with all this information that helps you manage things much better for now and in the future as well. And if you have time to fill out any feedback, that would be brilliant as well. We appreciate your feedback. Have a lovely day. Take care. Goodbye.